all of you can listen to this entire session without any disturbance. In fact, this is what I've been doing so far, just putting people on mute. And we have a chat box feature over here on the Zoom. So just in case, if you guys have any query, concern, if you feel stuck anywhere, just put it in the chat box and reach out to me and I will assist you. And yes, the main thing, wish you all a very, very happy International Women's Day. I'm so happy that we guys are doing this today. And to meet all of you lovely ladies on this special day makes it even more special for us. So thank you, everyone. I would really like to thank each one of you to come here and be a part of it. Thank you so much. And allow me to introduce myself. I'm Natasha Singh. I'm a transformation coach and your virtual host. I'm really excited to host this entire event and workshop for you. And like I said, that I will be your Ginny for the day. So just in case, if you feel stuck or if you have any query, please put it in the chat box and I'm the person who'll be happy to assist. So moving forward, let me give you a quick tour of what you can expect out of this masterclass. So the first thing that we're going to do is that we're going to have a talk by an Ayurveda expert who will come and shed more light on that how Ayurveda looks at different health concerns and how it can transform your health totally. Then we are going to have a talk by a yoga expert, and especially about therapeutic yoga sessions, that what a therapeutic yoga session looks like and how it can be really deeply effective. After that, we are going to have some face yoga, some foot massage, and post that we are going to have certain announcements that we'll be making over here. Okay. Now, for our yoga sessions, please allow me to introduce please allow me to introduce our health experts for our yoga and our Ayurveda sessions. We have Dr. Shehnaz. She is a certified Smriti meditation practitioner. She's a gold medalist from BPSB Ayurveda College, Kerala, and she is right now here with us to take this session forward. So without any further delay, I would request her to take over the session and take it from here.
Thank you so much, Natasha. Yeah. So a very pleasant good evening to one and all, and a very happy International Women's Day to all the gorgeous women who have joined us today. So yeah, today I'll just speak about how Ayurveda can help women cross each phases of their life. So each stage of their life is like, a roller coaster of hormones. Like there is a considerable change of hormones in starting from puberty, and then comes the reproductive age, and then have the milestones of pregnancy and then delivery, and then leading to menopause and finally reaching our aging. So I'll be speaking about how Ayurveda can help with the physical and mental challenges that women face during this period. So I would like to request to share the screen. Thank you, Natasha. Yeah, so first we'll start with the mental and physical challenges that girls face when they start to change into womanhood. Next slide, please. Yeah, so it starts with puberty to adolescence. So in puberty, the major change happens, that is the start of menstruation. So then the girls experience like back pain, lower abdominal pain, and many mental challenges like mood swings, and then they face irritability, anxiety, and the list goes on with each and every individual. Yeah, next please. So how can we take the help of Ayurveda during each of the physical and mental health concerns that we have? So the major symptom that every woman commonly face is lower abdominal and lower back pain, along with mental agitation or the irritability or fatigue or some sadness, the thought of having this all you have to do your activities along with this menstrual cycle going on. So it leads to many mental and physical problems. So then one common disease that we find during this age group is PCOD, or the polycystic ovarian disease, or polycystic ovarian syndrome. So how Ayurveda can help during this period, during your menstruation days? Yeah, next please. So first, it's the main topic that Ayurveda covers during the menstruation period is having a regular menstrual hygiene routine. So for that, you need to change your pads regularly, like within 4 to 6 hours, and then clean your vaginal area very clearly, which helps to avoid infections during the period. And it is always advised to have light and warm meals, to have 1 teaspoon of ghee in your diet. So that helps to reduce the abdominal cramps that you feel during the period. And having herbal teas with the ingredients like ginger, cumin, coriander, all these help to flush out that extra waste that is coming out and to ease your abdominal cramps. And finally, when you have the Deepika is asking a question, 1 teaspoon a day by itself. Exactly, 1 teaspoon in your meal, either, in the lunch, whatever you are having, or in the dinner. So it's, you have to decide it according to your level of digestion. So for that, it's good when you consult an Ayurveda doctor and find out like if your digestive power is good enough to have ghee in your diet. But definitely during this period, 1 teaspoon of ghee improves having abdominal cramps. And then you can have hot water baths or heat packs over the painful area of your lower back. So it improves the blood circulation and then reduces the back pain. And also you can have castor oil in a napkin or a tissue and then place it on the painful area, be it the lower abdomen or the lower back. Next, please. And there are some practices which Ayurveda asks to avoid during the periods of your bleeding. Like you need to avoid very hot and spicy foods, which actually will increase your bleeding. And then you need to avoid day sleep and heavy exercises during this period. Yeah, next, please. Yeah, Jyoti has asked like how to use castor oil. So as I told, like you can take castor oil in a napkin and then place it over the painful area. And now coming to a one important home remedy, fenugreek drink. So you can take 1 teaspoon of fenugreek seeds, soak in 1 glass of water and add honey, which is optional. If you want, you can add 1 teaspoon of honey and then have it in the first 3 days of your menstruation, which will reduce the abdominal cramps. And if you don't have fenugreek seeds with you, you can take fenugreek powder, which is available in the Amazon. And then you can take 1 teaspoon of fenugreek powder and then have it 2 to 3 times a day in 1 glass of water with adding honey, or if not, you can avoid honey. So according to your taste, you can add or avoid honey. Yeah. And next, please. And then the girls face the most problem during this period is having acne due to hormonal outbursts. So for that, we can have a homemade face pack for acne. For this, the main ingredient is orange peel powder. So either you can dry out the orange peel in sunlight and then powder it and keep it, or else orange peel powder is available and then you can buy that. 1 teaspoon of orange peel powder in 1 teaspoon of yogurt or honey. So how do you choose whether you need yogurt or honey? So if you have a very oily skin, which is very prone to acne, so then it's better to have honey instead of yogurt. But if you have a dry skin, but then also you're having acne, then the good ingredient would be yogurt. And then to have gram flour or oats powder. So this you can powder and then have 2 teaspoons. So 2 teaspoons of oats powder, 1 teaspoon of either yogurt or honey, and 1 teaspoon of orange peel powder. So you need to mix it and then have it in a paste consistency form. So you can apply this over your face and don't forget to apply it over the neck. So whenever you're applying anything on your face, spread it over your neck also. And then keep it for like 15 to 20 minutes. Or when it starts to dry, you can remove it. So Ayurveda emphasizes on this point. When the face pack starts to dry, you need to remove it. It's not like it should be completely dried up. So that affects your moisturization of the skin. So it's always good to remove the face pack when it starts to dry. Yeah, next please. And then one lifestyle habit that Ayurveda advocates to take care of from the adolescent period is to avoid suppressing the urge of urination. So usually girls don't feel like going in, public toilets or the toilets they have in the schools because of hygienic issue or hesitation, whatever the reason, they skip going like urinals in the schools or public places. So it's actually, when you hold this urge of urination for a longer period of time, it affects the laxity of your pelvic floor muscles. So then you will have urinary incontinence in your later ages. So if you think, if you're having, like, if you're above 50 years of age and having, urinary incontinence, now at this age, like after 50 years of age, you can just think backward, like whether you were holding the urge of urination in your adolescent period. So this affects your laxity of the pelvic floor muscles. It affects the strength of this pelvic floor muscles. So it is always advisable to not hold the urge of urination. And this can also harbor bacteria over the region, causing to recurrent urinary tract infection. So then, and also it can lead to urinary calculus. So make sure that you're not holding the urge for urination. Whenever you get the urge of urination, try to pass it out as soon as possible. Yeah, next. And then, so these are the basic things that we can take care during the adolescent period. Then women reaches the reproductive age where she has to play a multiple roles, like she becomes a daughter, or like she becomes a wife, mother, and then daughter-in-law, and then comes a role, multiple roles to play. So there, the mental health status needs to be taken care of. Next, please. So first, we'll start with the pre-conceptional care during the reproductive age, when you are longing for a child or when you are preparing yourself to have a child for yourself. So first, the main concept that Ayurveda emphasizes during this period is saumanasya. Saumanasya means normalcy of psychology or having a pleasant mind. That is to reduce stress and have a pleasant mind. So you need to take care of the things which can reduce your stress. So there are many external factors that will affect your mental health level, which is not in our control. But definitely we can have some cope-up strategies which can be included during this period so that you will have a good, happy, and pleasant mind. So whenever you want to have this conceptional care, you can start it within 1 month whenever you are going to start. Like 1 month is the period where Ayurveda advocates the procedures like detoxification. It's called as panchakarma. So it has many sort of, detoxification procedures like MSCs, purgation, and then medicated enemas to flush out the toxins has built up or accumulated in your body from longer period. So it helps to purify the body and have the proper function of your reproductive health organs. Then the two basic ingredients that Ayurveda advocates which can help with your conception is sesame seeds, which regularizes menstruation and have the can increase the chances of conception, and also black gram, which is having the main ingredients like vitamin B, folic acid, all these which can help with the factors of conception. And finally, it is always advisable to have a balanced diet so that you have a balanced bioenergies in your body. Next, please. So these are the basic concepts that Ayurveda advocates during pre-conceptional care. And it is always emphasized to avoid processed foods, too much of coffee, tea, alcohol, or cold drinks, and also the lifestyle habits like day sleep or even night awakening, and then heavy exercises, and avoiding the use of like overuse of mobile screen, which can affect your nervous system and then affect your mental state. So as I told, like having a pleasant mind is the important factor that Ayurveda emphasizes during this period. Next, please. And then we reach the stage of pregnancy. So Ayurveda has a whole regimen to take care of you during the pregnancy period. So it starts from the first month to 9 months, there are many diet procedures, there are many lifestyle habits that Ayurveda advocates during each month of your pregnancy so that you can have an easy delivery at the end. So basic general tips that Ayurveda emphasizes here is having an appetizing meal, which can help with your symptoms like nausea, vomiting during the first trimester. And also including milk, butter, ghee in your diet, which can regularize your bowel movements, and having a good proper bowel movements during the period of pregnancy is very much important to have an easy delivery at the end. So, and it is also mentioned to have light meals and a balanced diet to improve your digestion, which will also regularize your bowel movements and which will also help in proper nourishment, whatever we are having, and proper absorption of the food, whatever we are having. So for this, these are the general tips that is mentioned here. Next, please. And then when a girl, like pregnant woman, becomes a mother, so as a new mother, she has this, mixed emotions and feelings. First, she'll be having, very much proud and awestruck with the fact that she has given to, birth to a life. She has, like, given this birth to a new human being, which makes her very proud. But also at the same time, her physical factors, like her sleep is affected, she's having pain all over the body, and then she tries to bond with the baby, that new human being, and then she has problems with that, and she constantly questions herself, like, I'm a good mother. All these, mental turmoil happens during this period. So first 42 days after your delivery in Ayurveda is considered as a crucial period to have most self-healing and self-love procedures. So it is also advised to take frequent small meals to give proper nourishment. And if you are feeding to attain that proper nourishment, it is always advised to have frequent small meals. And then there are many medicinal procedures that Ayurveda explains during this period, which can be taken care of, like oil massage, having herbs and medicines throughout the period, so that it reduces the exhaustion that the women undergo during this period, physically and mentally. Next, please. Yeah. So then after going through all this, the women reaches like 40 to 50 years of age. So at that time, she has, like, many roles to fulfill. She'll have to take care of your, spouse or your in-laws or whoever they are, your parents or your children, and the list goes on like that. So it's very important to have some self-care routine, or it's very important to spend some quality time with yourself. So I would like to hear what are your me time, you do, what are the activities that you do yourself to, keep yourself happy, so you can, like, put your me time things, activities that you do in the chat box. So it is very essential to have, that quality time with yourself. Fulfilling all the roles makes women sometimes overwhelmed with responsibilities and then affects her mental health. So by the time we realize that, we have passed all 3 ages and we haven't done anything for ourselves, that affects your mental health. So it is very much important to have the me time towards you. Next, please. Yeah, we are getting some responses for the me time. Saroji saying, like, walking out in nature, yoga. It is, yeah, it's very nice. And then here comes, like, after, all these things, the start of menopause, or there is the stoppage of reproductive function. Your reproductive organ functions of your organ starts to decline. At this period, the most important thing that happens in your body is deficiency of the main female sex hormone, estrogen, which affects your bone health, like leading to osteoporosis, and then many, mental health issues like mood swings, irritability, which also is affected because of this menopausal period. And then you have the, pelvic floor laxity leading to urinary incontinence, or other bladder control problems leading to urinary incontinence. And this is a crucial period to prevent lifestyle diseases. So this is a period when lifestyle diseases starts to pop up. So it is essential to have certain, strategies to prevent lifestyle diseases during this period. And also many types of breast cancer, uterine cancer, cervical cancer screening happens during this period, which affects the mental health of women. So it is also advisable to have, stress reduction strategies during this period. For all this, it is essential to have a proper routine. Next, please. So then that will help you to have that proper physical and mental strength during the period. For that, you need to have a proper sleep wake routine and a proper work routine and a self-care routine. And finally, spending some family with time with your family, which also affects the, which gives that boost to women to go forward with the life. And also, Ayurveda advocates the special procedure like Abhyanga or oil massage, which can be done every day in order to prevent the effects of aging, which you will face in the coming years. Next, please. So this oil massage is advocated like to have as a daily procedure. So for that, what kind of oil you should use or can be decided according to your body type. For that, having a proper Ayurveda consultation is necessary to find out your health conditions or the proper body type you have, and then have the right oil for your body, and then have the oil massage every day. And here I can also say about an anti-aging face pack. So for that, we can have amla powder or the Indian gooseberry powder. So this is also available in the Amazon, or you can just dry out amla and then powder yourself. So take 2 tablespoons of amla powder, 1 tablespoon of yogurt, and 1 teaspoon of honey, 1 teaspoon of olive oil. So oil is an important ingredient in your anti-aging face pack because it can really help with the effects of, anti-aging, give you that revitalizing effect and give your skin that special glow, which will prevent the effects of aging. Yeah, next please. So you can try out this face pack and see how your face glows. And finally, we reach the elderly years when we start to decline our physical strength. There is a decline in function of our sensory organs, like impairment of hearing or loss of vision, and then you have many financial or social issues when you need support, when you are craving for support. Till these years, you will be giving care, and this is the period when we need care. So at that time, maybe proper care won't be available, which affects the social and mental status of a woman. And most women affect with uterine prolapse during this period, and also frequent falls due to weakness of muscular system, and also impairment of functioning of your nervous system. So for this, Ayurveda advocates a special procedure known as Rasayana, or the concept of rejuvenation. Next, please. Deepika, uterine prolapse means your uterine organs, the uterus comes down over your vagina. Then the next is, yeah, exactly, the Rasayana, or the special revitalization ingredients or techniques that is mentioned in Ayurveda. So the basic ingredients here mentioned is ashwagandha, which boosts your memory and which helps with proper sleep, and also Brahmi, gooseberry. So these are Indian herbs or ingredients which can be taken every day according to your body type. For this also, it's always better to have this direct consultation and fix out which ingredient works for you better. And there are plants like medicated enemas which gives you proper nourishment, and having potlys or herbal pouches or things that you can apply over the painful area. You may be having like joint pains during this period, so to reduce the pain you can take the help of some herbal potlys and herbal pouches, which will help with your joint pains and other disorders. So this is how Ayurveda can emphasize during each stage of woman, each life stage of a woman. So your health during each stage actually reflects or decides your next stage of life. So it is also essential to have a proper healthcare routine from the early years of life. Yeah. Thank you so much for your patient listening. So I hope this would have give you a light on how Ayurveda can help women handle the physical and mental changes during each phases of life. Thank you so much.
Thank you so much, Dr. Shahnaz, for this really interesting and insightful knowledge about how Ayurveda can be so healing. And even I was going through the comments in the chat box, and it's really heartfelt and really interesting. So thank you so much. And now moving forward, we would be calling upon our two experts who are here to guide you through the yoga practices. But just a couple of points that again I would like to highlight before we get into the practice is that during the practice, yogic practices should be performed slowly with awareness of body and mind. Breathing should always be through nostrils unless instructed otherwise. Do not hold your breath unless it is specifically instructed. And you should end the practices with proper cooling down practices with proper relaxation. And just a minute. And I think I came way too ahead in my presentation. Just give me 2 seconds. I'll be back there. Allow me to share my screen. So just a few important points that if you have undergone any recent surgery or injury, kindly avoid the practice or seek the advice of your physician. If you have any stiffness or limitations in any of your joints or muscles that make the practice difficult, kindly avoid the particular practice and proceed with the others. If you have any severe health complications, kindly do the practice only after consulting the physician. And with that, I would really like to call upon Dr. Trishna, who's a yoga consultant at Nirva, and she has 20 years of experience in health and wellness roles. And along with her, I would also like to invite Dr. Khushbu, who's a certified yoga practitioner and will be taking you through all the yoga demonstrations. So with that, again, I would like to hand over this to our both doctors who can guide you through from here.
Thank you very much, Natasha. I'm very glad to be here as a part of this International Women's Day celebration. While we are celebrating womanhood, I think it's very important for us to also kind of appreciate who we are, isn't it? Because we have done so well all throughout life, whatever stage we are in. So this is one effort from our end to actually appreciate that. All right. So starting with therapeutic yoga, Natasha, can we have the slides, please? Yeah. All right. Thank you. Yes. All right. So as in the Ayurveda session itself, starting from different stages and going through the entire lifespan of a woman. Adolescence or premenstrual phase is, that is a time when the child is suddenly becoming a woman and there are so many changes happening, physiological changes. We know that, body develops and girls are kind of trying to find out, who they are, why these changes are happening. So the first thing yoga suggests is to accept whatever changes are happening with you. Accept yourself as you are, whether you're a child, an adult, doesn't really matter. There are psychological changes as well, dealing with different emotions. Sometimes, children have this outburst of emotion. So if you have teenagers at home, you know how challenging it can be to kind of, deal with them. Sometimes they want to be independent. Sometimes they want your advice. So all these changes happening, plus psychosocial changes. So there is a lot of peer pressure. Social acceptance becomes very, very important. Now here we know that with social media, it is always, children are on Instagram or Facebook or something, and they're always kind of wanting to be, perfect in that virtual world. So with all the changes, it also comes with a little bit of imperfections, and to actually accept that this is a changing phase and this is something which is very important for me to grow into a beautiful woman. So that is very, very important. So can we have the next slide, please? Yeah. So as the first menstruation strikes, so the physical changes, again, what yoga recommends is to have a physical discipline. So here, healthy lifestyle habits are very, very important. So what we recommend is to actually have, proper physical practices like asanas, which are kind of mild and which can actually open up our joints, which can activate your whole body and help in circulation of blood. Rest and relaxation is a must because we must have seen the teenagers sleep a very long hours, sometimes. And they also tend to kind of, become a little bit erratic about their sleep pattern, their food habits, everything. You know, they want to look good and they want to feel good, and all these things, come in at that time. So it's very important to have a perfect routine, with diet, with physical activity, with rest and relaxation. So regular baths is a must to keep yourself clean physically. And of course, yoga always talks about sattvic food, which is like a positive kind of food which nourishes your body. So it doesn't make you lethargic or dull. It makes you energetic and active. And Vitahara. Vitahara is a concept in yoga which says that everything in moderation. You don't need anything too much in excess, not too little, just enough for you to actually nourish your body. All right. Then there are mental aspects. Now, mental discipline is something which is very much emphasized on yoga. If you look at the definition of yoga itself, it's all about, how to deal with your mind, which is very, very tricky in a way, right? So for that, yoga suggests something called yamas and niyamas, which I'll be explaining in the next slide. Right mental attitude of acceptance and mindfulness, being aware of the changes and not judging the changes, that is very, very important. Yes. Next slide, please. Yes. So in yogic practices, we usually see common symptoms in this age group, which is usually pain, pain in the lower abdomen, back pain, muscle cramps, bleeding, excessive bleeding is a possibility, especially in the initial phase of menstruation. There could be premenstrual syndrome, that is a couple of days before menstruation, the child or the girl starts getting breast tenderness, there is bloating, and there is so much of discomfort, mood swings, irritability, etc. So for all these things, how do we manage this? We can have a regular practice of yoga, especially something called Konasana series, which is like an angle pose series, which actually helps in improving the reproductive function and balancing the hormones. Stress management is very, very important here. So deep breathing is a must, and also a lot of awareness. Now here, one thing we have to focus on is health education. A lot of kids are a little bit confused here about, what's happening to them, why this is happening, and why should this happen to me? And sometimes they Google it, and probably they might get a lot of, mixed information from Google. So we don't want to have that. We should be the ones to actually educate them about all these aspects, giving them the right kind of input. So just to give you a glimpse of, one of the easiest and best practices we can do, can we have Dr. Khushbu do deep abdominal breathing with Akara chanting? This is very, very effective for all age groups, especially for teenage girls who have menstrual problems. Dr. Khushbu, can we have the demonstration, please?
Yeah, sure.
Yeah.
So try to take your own corner wherever you are, either in the chair, on the sofa, or down on your mat, anywhere. So just take a few seconds and settle down. So try to place your palms on your knees and now gently close your eyes and just watch your breath. Try to just watch your breath moving in and out at your nostril, undisturbed. Become aware. Now, along with this nostril breathing, we are going to synchronize our abdominal movements here. So slowly try to place your left hand onto your chest and the right hand onto your abdomen. And now gently synchronize this nostril breathing with your abdominal movements. Inhale and watch your abdomen balloon out. Exhale and watch it sinking in. Inhale and watch your abdomen balloon out. Exhale and let it sink in. 2 more rounds. Inhale, watch it ballooning out. Exhale, let it sink in. Inhale, let it balloon out. Exhale and let it sink in. Now, as you've become used to this abdominal movement, now let's gently start with Akar chanting. So place your palms back on your knees, keep your eyes closed. Now just inhale, watch your abdomen balloon out. And as you exhale, open your mouth wide open, unclench your jaw and chant Akara. Inhale. Ah. Inhale. Ah. Relax with just one more round. Inhale deeply. Ah. Now just watch this resonance permeating your body. Feel the deeper connection with your body. Now gently bring your palms together, rub it against each other. Make a gentle cup, place it on your eyes, and just open your eyes with a few blinks and relax.
Yeah, thank you, Dr. Khushbu. So that is a simple practice we all can do to actually improve the function of our reproductive organs. Can we have the slides, please? Yeah. All right. As I was talking about the practices that yoga recommends for teenagers, it is mostly based on external restraints and internal observances. They're called yamas and yamas in Ashtanga Yoga. Here, the focus is basically to build your character. So it has to do a lot to do with what you do with yourself and how you deal with the external world. Now, there are 5 yamas. One is non-violence, non-stealing, truthfulness, non-possession, and sexual control. Now, because this is also an age where children are kind of figuring out what is important and how I should, deal with different difficult situations in life and my own urges. So this is a very good practice to actually bring all those things into balance. As I said earlier, mitahara or something like a moderation is the key here. And niyamas, this is internal observances where you're thinking about cleansing. So cleanliness is very, very important, physical as well as mental. Self-study. You're always kind of introspecting and finding out who am I and how do I deal with the world? All right. Contentment. So being happy about what you have in life, whether I have this body and I'm fine with it. I'm happy about this body. I don't want to kind of, get somebody else's body and be somebody else. Ishvara Pranidhana, which is like surrender to the Supreme and self-discipline. So these also give them a routine to kind of, deal with stress later on in life. So this can actually build their character, integrate their personality. All right. So can we have the slides, please? Yeah. So in this situation, most commonly what we see is something called polycystic ovarian syndrome or disease, okay, where the symptoms are usually irregular menstruation. Sometimes ovulation doesn't happen. Children these girls kind of gain weight, and it comes with a lot of other symptoms as well. So sometimes facial hair and a lot of hormonal changes. Here, the basic cause is hormonal imbalance. So how do we actually deal with it? Okay. So we are managing, one is the root cause through certain physical postures. Pranayam, breathing exercises are very, very important here, and meditation. But when we think of weight, the common symptoms we see is, weight and stress. Okay. So to address this, we can always suggest deep breathing, abdominal breathing, Surya Namaskara or sun salutations, Chandra Namaskara, which is excellent for balancing your hormones. Okay. That is moon salutations and relaxation techniques. So we can just have a look at one of the practices here, Titli with Baddha Konasana, which is actually very good for all our reproductive organs, especially when a girl has something like PCOS. Can we have the demonstration, please, Dr. Kushbu? Yeah, Titli with Baddha Konasana.
Gently sit with your legs outstretched. Now slowly try to bring both your legs towards your pelvis. So do not mind where your legs are, but just try to stretch your inner thigh muscles. Now keep your back erect.
And now, as and when you're comfortable, gently flap your thighs. Flap your thighs up and down, opening up the hinge of your hip. Focus upon and bring all your awareness to your pelvic floor muscles. So you can gently keep your eyes closed and just keep your focus there. Now, as you practice, slowly stretch down to the floor. Now, slowly, we are going to go to a little deeper stretch of Baddha Konasana. Now, try to just gently stretch your hands forward, lean down, and as and when you're comfortable, lean fully down and place your head down. If you cannot, you can come on your forearms and just stay there for a couple of breaths. Take around 4 to 5 breaths. Feel that inner stretch. Just keep breathing. You're letting your pelvic floor breathe. So just stay there and keep breathing. Inhale and come back up. Very nice. Now gently relax. Take a nice deep breath. Now gently outstretch your legs one by one. And just gently relax. Give a mild movement to your legs and relax. Thank you.
All right, thank you, Dr. Khushbu. Now, I'm also seeing a couple of messages in the chat box. Some of you may not be able to do it. Some of you may have had surgeries. So it's always good to have a consultation before you can do things like this, okay? But if you do not have any problem, there is no harm in doing it at all right? Okay. So from menstruation, reproductive cycle starts, and then the next phase that comes in a girl's life is pregnancy, or a woman's life is pregnancy. Here, we are looking at two things. One is just before being pregnant, that is preconception. It is very important to actually prep our body and mind to be pregnant. Now, sometimes this really doesn't happen in most of the cases, but this is extremely important according to yoga. Now, sattvic diet is something which is a nutritious, very nourishing diet, which is again positive to your body and mind. Okay. Then what is very, very important is to have positive thoughts. Sometimes, we always say, first child is usually like a chance, you don't know that you are having a child and suddenly, you're pregnant. But that should not be the case. We should have positive thoughts. If, you're married and you're kind of having, plans to have a child, then it's very important that we follow these things. So positive thoughts, so we can do meditation practices and give a lot of positive affirmation about how glad I am to be in this space and how glad I'm to be excited to be a mother. Cleansing practices. So Kapalbhati is a very good cleansing practice to actually get rid of all the toxins from our body. So is Nadishuddhi Pranayama. So Nadishuddhi is called the cleansing breath. So it helps in actually getting rid of all those blocked toxins from our system and ease out the flow of energies. Now, deep breathing and pranayama definitely recommended, and so is the asana practice, certain physical postures which can actually again balance the hormones, improve the function of nervous system and endocrine system. That is extremely important here. And I think some of you have already mentioned, in your free time, you do like doing yoga, and you already have seen the benefits of yoga. And here, this is very therapeutic, this is very specific for what we're going through. All right. And then there's post-conception. So now that the woman is pregnant, then there is the first trimester, the first 3 months, when the organs are developing, the tissues are getting, the cells are becoming tissues and the tissues are becoming organs, and so many changes happening the first 3 months. That also comes with a lot of challenges of, nausea, you may have morning sickness, anxiety sometimes, and then a lot of, discomfort in your entire body. So here we always recommend breathing techniques and relaxation techniques. We do not recommend heavy physical practices. Now, a lot of people ask me this question, like, are we even supposed to do yoga during the pregnancy period? Yoga definitely can be done, but we do not recommend heavy physical postures in the first 3 months, right? But we can do mild joint exercises and, of course, meditation and positive affirmations. Now, this is very important because this is the time we want to bond with our child, all right? So having a positive thought in your mind is very important for the child also to imbibe that feeling, all right? Coming to the next one, which is second trimester and third trimester. Yeah, next slide, please. Yes. So second trimester is kind of a safe zone. You can do almost all the practices. Okay, not much of a contraindication here. Here again, you are also seeing that your belly is growing big. So sometimes you may find it a little bit discomfort to move around, doing a lot of practices. But all the practices can be modified to perform at this stage. All right. And the third trimester, the most important thing is to open up your pelvis. You're kind of, looking forward to a normal childbirth. You don't want it to be complicated. So to ease that, we can actually do a lot of practices like imaginary chair pose, there is garland pose, bound angle pose, half lotus pose, leg raising, and restful inversion. Now, this can be done with some practices can be done with wall support, some with pillows and cushions, so that it's easier for you to move into the pose, and it actually helps in easy childbirth. So labor becomes easy and very, very pleasant. And of course, we have to emphasize on rest and relaxation. All right. Okay. Coming to the next practice. Yes. So, okay, now the child is born, we are all happy and everything, happy ending. No, because that also comes with the challenge of weight gain and, women going through sometimes depression, postpartum depression, which is becoming very common these days. So here we are definitely looking at the first 3 months. Yoga does not recommend too much of heavy practices, but mild practices, mild joint exercises, breathing, relaxation, and meditation. So here, this will help us prevent postpartum depression because you can bring the hormones back into balance. You can get your body moving and flow of energy. Now, weight management is key, and establishing breastfeeding, that's so important because you want to bond with the child. And sometimes it comes with a lot of confusion also, like, why am I not able to feed my child, or am I feeding it right? So all that anxiety and stress that comes with new motherhood can be managed with yoga practices. And also the acceptance part that now we are, responsible for a lot of things, and that also is a huge, huge change in a woman's life, isn't it? It is enjoyable, but it is also difficult. All right. So here we recommend one simple practice, which is called, the previous slide, please, Natasha. We're going to do a practice here. Yeah, thank you. All right. So this practice is Ekapada Uttana Padasana, which is very simple again. It can be done by most of the people, right? So let's see how it is done. All right. Okay, Dr. Khushbu.
And simply try to outstretch your legs and slowly take up a lying posture. Take up your Shavasana and adjust yourself first. Accommodate yourself in the lying posture. Now, as and when you're comfortable, slowly bring your legs together and the hand by the side of the body, your palms facing downwards. Now, all you're going to do is gently lift each leg alternately to an angle of 90 degrees without bending your knees. So inhale, take your right leg up, hold on, keep breathing for a few seconds. 5, 4, 3, 2, 1. Exhale and down. Now the other leg, inhale, take it up, keep it stretched for a few seconds. 5, 4, 3, 2, 1. Inhale and down. So 2 more rounds. Again, slowly stretch your right leg up. Keep breathing. 5, 4, 3, 2, 1. Slowly breathe out and down. Your left leg up. Slowly keep breathing. 5, 4, 3, 2, 1. Relax it down to the floor. Now gently outstretch your legs and your hands in Shavasana. After taking a couple of breaths and relaxing your body, gently try to outstretch your right hand and fold your left leg and try to turn towards your right to take up a sitting posture. To be very gentle when you make a transition, to not be in a hurry, and gently take up an easy sitting.
That was a nice stretch to your leg muscles, wasn't it? I hope you have enjoyed it doing it. Yeah. So can we have the slides, please? Yes. All right. So after the childbirth and all that thing, what comes next is when we reach our 40s, suddenly there is a change in our hormones. We start feeling that, our cycle is becoming irregular. We start feeling hot, sleep disturbances, vaginal dryness, and urinary urgency. So we feel like going to the washroom frequently. Now, this can actually start from 40s. It can become, severe by another 45 or 50, where we step into menopause, and then it can also last for the postmenopausal period, wherein actually all the symptoms can worsen. So all the things that we experience, the irregularity of cycles, hot flashes can become so worse that it can interfere in your day-to-day activities. So here, can we actually balance this naturally? Do we really need to go for that hormone replacement therapy? We can do this naturally with some pulling pranayam, okay? Some asanas, again, as I mentioned, which is very, very specific for hormonal balance, okay? And also depending upon the symptoms one has, depending upon their body types and the symptoms they have. Strengthening pelvic floor muscles. Now, this is very important because we know multiple childbirths can make our pelvic floor muscles very, very soft and lax, okay? And that is when we end up having uterine prolapse or cervical prolapse, where your uterus is actually bulging out through your vagina. And this is the right time for you to actually start practicing pelvic floor exercises. One of the best ways to do it is something called Mula Bandha, all right? And also improving our mood, because suddenly, you're becoming irritable and family members are noticing it. So we don't want to go into that space. So mindfulness practice is exceptionally good in this situation, okay? And also, yeah, urinary urgency can happen because, of the laxity of muscles, all right? So our muscles are not strong enough anymore. So we have to kind of do something to strengthen it. So for all these stages, one of the best practices we can do is called Setubandhasana or bridge pose. Now, those who have very severe neck pain and cervical spondylosis may kindly avoid it, but rest of you can actually practice this. This is pretty good and can actually stretch your back and strengthen your pelvic muscles. Okay, so let's see the practice here. Yeah.
Gently outstretch your legs and try to take a lying posture. Accommodate yourself first in Shavasana. And as and when you're comfortable, bring both your legs together, your hands by the side of the body. Now gently try to fold both your knees and try to create a shoulder distance between both your knees. You can grab your ankle joint or else place your hands by the side of the body. Now, as and when you're comfortable, gently raise your hips up and go for a full stretch. So keep breathing. Do not restrict your breathing. Feel the stretch in your abdominal muscles and bring all your focus to your pelvic floor. Just stay there and take a couple of deep breaths with all your awareness at your pelvic floor. Feel that your pelvic floor is breathing beautifully there. Now inhale and stretch yourself nicely down to the floor, tucking your tailbone down. And gently outstretch your legs and be back to Shavasana. Once you're relaxed, slowly try to transition yourself into sitting. So gently stretch your right hand, hold your left knee, turn towards your right. Avoid any jerky movements and be gentle as you can as you transition yourself into a sitting.
Yes. When you perform this actually every day, it can actually strengthen your pelvic floor muscles and make your back also much stronger. All right. Yes. So after menopause and again in menopause, we have some very specific practices like Shitkari, which is a kissing breath, Nadishuddhi Pranayam, Konasana series angle poses, which can actually work on a pelvic floor. All right. Can we have the next one? Yes. Yes, in postmenopause phase also, as I had mentioned earlier, all our symptoms worsen, but we also get some additional things like, brain fog, where you're kind of having not that clarity of mind, okay? And osteoporosis can set in, so all your vitamin D levels can go down. You may be more prone to fractures and falls, all right? And also depression can set in because of the huge change or drop in your estrogen levels, which is a female sex hormone. So we can actually plan regular practice to bring the estrogen levels back to normal, because the whole body function is actually based on the balance between different hormones. Okay, so here different practices are very, very important. yoga nidra, one of the practices, can actually calm yourself down and completely relax your whole body and mind. All right. Can we have the next slide? Okay. Along with menopause also comes a lot of chances, or the kind of lifestyle diseases like heart diseases or diabetes, osteoporosis, and urinary tract infections become very severe, or it can go into complication phase at this stage because of the huge change that is happening in our body. So here we definitely recommend a, a perfect lifestyle intervention. All right. Diet usually recommended is plant-based. Okay. And regular physical exercise. And now, sometimes what happens is, we kind of hit the gym once in a while, we go for walking once in a while, but we need to do everything regularly because that is something which has to be a part of our lifestyle. So regular yogic asanas, swimming, walking, jogging, all those things are very good. Now, sun exposure is very important because you want to have all that vitamin D that your body can produce. And for that, sun is very important. And having the right kind of positive attitude is important. Sometimes we say aging gracefully, isn't it? So we accept the changes that is happening within us and we are perfectly fine with it, isn't it? So mental health, positive attitude, and meditation, these are very important. Yes. Next slide. Yeah. So also above your 60s, definitely we are looking at, aging has set in. So we see that, the changes, wrinkles on our face, graying of our hair, and whatnot, right? And definitely there are biological, psychological, and social changes. So here, definitely, what are we aiming at? We are aiming at cognitive reserve. That means we don't want a brain function to go down, cognitive decline. And we have to manage comorbidities. That is, if you have diabetes or heart disease or something, we have to manage it well because we don't want it to go into disability. All right. No complications. And then providing social support is so important. So that is one of the reasons we have this community sessions. We have this Facebook group where we can interact with each other, we can share our thoughts and be there for each other. That is so important, especially during this age group. Yeah. Now, here again, we are looking at proper nutrition with the right kind of positive diet. Psychosocial needs can be met with support groups, meditation practices, activity and exercise. Asanas can be done. A lot of people might think, I'm old and I cannot move that well. My body's stiff. I don't think I can do all those twists and turns. But yoga is not about all that. It is just the attitude you have, right? The awareness, the breathing, and the positive attitude you have when you attain a posture. So you can actually do it on a chair or on a bed or wherever it is comfortable for you, or with a lot of support with, pillows, bolsters, straps, anything. Only thing what is important is to get our body moving, get all the joints, more flexible so that we don't go into a space where we have, immobility, right? So there is a possibility of knee injury in yoga, all right? So what is important in yoga is we prevent osteoporosis, okay? And if there is osteoporosis, we are able to manage it. Cardiovascular metabolic conditions can be managed well. Dementia, we can prevent dementia, anxiety, and depression if we start yoga early enough, therapeutic yoga, all right? And it has a very important role in rehabilitation and disability. Suppose you've gone for a surgery and you've recovered from a surgery, therapeutic yoga can actually help you recover faster, all right? Okay. So here, the best part about yoga is, it's non-invasive. So you're not doing anything, cutting open your body or nothing of that sort. It's safe, it's cost effective. You don't need too much of equipment, right? You can just do it in your living room with a simple mat and everything will be done. And the best part is that there is physical, mental, psychosocial, and spiritual health, right? And of course, as I mentioned, we can prevent complications and disability and improve the quality of life. We do not want to live without dignity. We want to live with dignity. We want to be happy about who we are and how meaningful our life could be. So yoga can help you, therapeutic yoga especially can help you do that. So we are actually helping you lead meaningful and contented life, and hope all of you actually are able to reach that point where you are happy and healthy. All right. And therapeutic yoga is definitely one of the best ways to do it. So I'm really glad to be here to be able to kind of share this knowledge with you, be a part of this International Women's Day celebration. Thank you. And over to Natasha for the rest of the exciting stuff that you're all waiting for. Yes.
Thank you. Thank you so much, Dr. Krishna, for this. And I'm sure that this would have given a lot of insight to all our lovely ladies over here. So let's proceed further. And now time for us to do something really interesting. And for this, I would like to call here Dr. Khushbu to take you through some face yoga techniques. So Dr. Khushbu, if you can just take over the session from here.
Yes, sure, doctor. Hello, all of you lovely ladies. So it's really nice to have you all here, and I hope all of you are excited to have this face yoga. So before we begin, a couple of heads up. Try to clean up your face before you start with any tissue. Clean your hands because it's very necessary that everything is clean and sanitary. So now, if you're comfortable, you can use up any of your moisturizer to just moisten your face, as dry face might not help in easy movements. So slowly take up your moisturizer. Yeah. You can practice along with me. So now gently rub off your moisturizer and smoothen your face across. Yeah. So I hope that we are all ready to practice. So first thing, let's start with a nice gentle palming. So nicely rub your palms. Try to create a little warmth. Nicely place it on to your face. So 2 more rounds. Nicely practice a gentle palming. Rub your palms and try to place it onto your face. 1 more round. And just try to place that warmth onto your face and spread it across. So let's start by nicely improving the circulation to the face. So just use your fingertips to mildly tap your face. So just use up your fingertips and keep on tapping your face. So just use your fingertips and also your neck. Keep tapping. Yes. You're there. Nicely improve your circulation and keep tapping. Yes. So now one more movement added on to this to nicely flush up your cheeks. So just start telling wow. Okay. So just give a nice lip movement of wow. Relax. And let's nicely start with the forehead. So let's start first with a nice gentle smoothing movement. So take your 3 fingers, place it at the center part of your forehead and slowly smoothen it. So you can gently close your eyes and nicely smoothen it and take it nicely down up to your ears. So the pressure, whichever you like, be gentle. 3, 4, and slowly 5. Very nice. Now let's gently massage the center area where a lot of us carry stress. So just try to hook your finger this way and just try to fan this here. So you're just fanning this moment. So slowly keep fanning gently. Now relax. And slowly let's improve the lymphatic circulation to this area. So just take a V shape, your index finger and your ring finger. Now slowly place it at the corner of your eyebrows. Now just start from a nice diverging point and converge it to your head. Yeah. So slowly start from here and nicely take it to your end of the scalp. So start at the edge of your eyebrows and drag it to the scalp. 3, wait, 2, do not bring it back. Just take your hands once you're off to the scalp. And 1. Very nice. Now just gently relax. Now let's focus upon this temple area. So take your two fingers, gently place at this temple area and give a mild clockwise rotation. Keep your eyes closed. This is the area where most of us carry a lot of tension. So just gently keep rotating as you smoothen your eyes. Very nice. Great. Now let's start with the eyeball. So a lot of us might have puffiness in our eyes. So let's work on that. So for that, gently use your index finger and give a nice rotatory movement around your eyeball. Okay, so smoothen your hands nicely and give a nice good rotatory movement. We're going to focus upon just depuffing that area. So keep your eyes mildly closed and just nicely smoothen your hands. The pressure, whichever you like. And now once you're done with this, gently use your finger to just tap down. Only the down area. So use only two fingers and just tap. Now take a hook of your index finger the same way. Place it at both the corners of your nose and just gently drag it under your eyes. Very slow and very mild pressure. Okay, and take it nicely up to your temple area. So you're just smoothening it and taking it nicely up to your temple area. 3, 2, and 1. Very nice. Now just nice pinching moment onto your eyebrows. Okay, so first just smoothen your eyebrows. Place two fingers, your thumb and your index, and just smoothen it. 1, 2, and 3. Now gently start pinching. So use your two fingers. You're just going to pull the skin and relax. Pull the skin and relax. So mild pinching movement. So just keep on pulling the skin and relaxing it. Now the same way onto the under of your eyes. So just pull the skin slowly and relax. So mild pinching movement, but just pull your skin and relax. Very nice. Now let's work on this cheekbone. So take the same hook of your index finger and work around your cheekbone. So take it nicely high. Okay. So start on your cheekbone and just take it, pull it high up. Start on your cheekbone, pull it nicely high up. Start on your cheekbone, pull it nicely high up. Now take your three fingers and smoothen the same at your cheekbone. So just smoothen it. Just smoothen the area. 3, 2, and 1. Very nice. Now let's work on this mouth line. So slowly use your index finger and smoothen the mouth lines. And 5. Now just nicely puffing your cheeks. So just hold your air inside your mouth and just gently tap. Relax. Now the other side. Relax. Now a nice jaw angling. So just place your index finger and your thumb and angle your jaw. So you can also use one side first. 5. Take it nicely high up. 4, 3, 2, and 1. Now the opposite. 5, 4, 3, 2, and 1. Now let's move on to the double chin practice. So for this double chin practice, try to make a fist of your hand and just work your fist down. So just nicely rub your fist down. Now start doing a nice scissoring moment. So just use your hands like this. Okay, and all you're going to do is work your hands to and fro like a scissor. Just work on the double chin area slowly. Very nice. Now gently relax. Now we're going to do a nice movement by just stretching your neck up and just giving a nice high kiss. Okay. So nice high kiss movement, like a pout of your lips. Okay. Relax. Now slowly give a nice neck stretch. So slowly inhale your neck up, exhale and down. Inhale your neck up, exhale and down. Inhale your neck up, exhale and down. Now nicely, gently do the same palming. Nicely wrap your palms and smooth it across your face. One more round. Place that warmth, especially on your eyes. So nicely create a warm, make a cup and place it on your eyes. Very nice. And just give a nice shoulder stretch before you end. So just interlock your hands at the back and just stretch out your shoulders and look up. Breathe in nicely. Relax. And now place your hands on your shoulders and give nice gentle shoulder rolls. 5, 4, 3, 2, and 1. Relax. So I hope that all of you enjoyed this. Handing over the session.
Thank you so much, Dr. Khushbu. Thank you so much for this. I hope, ladies, you enjoyed that nice, very unbinding face yoga. So thank you so much. And now it's time for something more interesting. So I would like to call upon Dr. Shehnaz. And now the next session is for foot massage. If she can just guide us through the entire thing.
Thank you, Natasha. Yes, so I hope everyone enjoyed the facial yoga. Now let's get ready for the foot massage. So you can take the same moisturizer if you have. Yeah. So Natasha, can you please spotlight Khushbu? Yeah. Okay. Yeah. So already, so just take a drop of oil in your hands and spread it over your palms. Or if you have the moisturizer, you can take the moisturizer and spread it over your palms. And then keep your palms over your ankle joints. Yeah. With the base of the palm, you can just massage your ankle joints. You can start to massage your ankle joints. So if ever you are suffering from fever, cold, or any such symptoms or any infections, you must avoid this foot massage for now. Or if you're having any, varicose vein or other thrombosis or lymphatic infections also, please avoid this procedure. Otherwise, you can give a nice massage to your ankle joints, and slowly with your base of the palms, you can start stroking your whole feet from the ankle joint towards the end of your toes. Nice stroking massage. You can give a nice pressure. So Ayurveda emphasizes on this foot massage. It understands feet to be a very important organ which gives you stability throughout the day, which gives you that strength throughout the day. So it's very necessary to massage your feet. Now, when the stroking is done, you can slowly start to massage your tendons. That is a hard structure that you can feel towards each of your toes. So using your both thumbs, you can just start massaging these tendons. Yeah, so to each and every toe, you can feel that hard structure. So it is very essential to massage these hardcore tendon-like structures, which gives you that support to keep you, energized throughout the day. Yeah. So you can use sesame oil, coconut oil, or mustard oil for this kind of massage. And always make sure that when you're using this oil, you can just take a bowl of hot water and dip this oil in that hot water to keep it warm. Do not directly heat the oil. Yeah. Now when the tendons are done, you can start with massaging your toes. Yeah, with the base of the thumb, give a nice pressure to each of the toe, starting from the base of the toe towards the end of the toe. So you can do the foot massage like at any part of the day, but mostly it is advised to do before going to your bedtime. So like 30 minutes before your bedtime, make sure that you have had your meal like at least 1.5 hours before. Yeah. Now slowly we'll start to massage the back of your foot. So there you have a strong tendon called as Achilles tendon, which is a hard coat-like structure. So give a nice massage using your thumbs. You can slowly move it downwards. So if ever you are suffering from varicose vein or other lymphatic, issues, like the direction can be changed. That's why I told if you are suffering from severe varicose vein issues, please do not do this. Yeah. After that, now slowly take your feet over the next knee. You can keep it over your next knee, and then we can start to massage the base of the heel using your both thumbs. So now we'll slowly move on to the base of the heel. Now give a good massage to the base of the heel. Yeah. And now slowly you can give the strokes towards the base of your feet. Either you can give the strokes or you can make fist of your palm, and then with the knuckles, you can give a kneading massage. Yeah. So this also reduces the pain over your feet. So this improves the blood circulation. So it is very much essential to take care of your feet. So that gives a very relaxing massage over the feet, right? Yeah. Now slowly you can start to massage your base of the toes with the thumb. Give a nice massage to each of the toe, and towards the end of the toe, you can give a small pressure, a mild pressure using your thumb. Now just bend your toes, and then you can find a groove. Below the toes, you can find that groove. Slowly start to massage that groove. It is told that it reduces anxiety. So whenever you're feeling stressed, you can try out this massage. Okay, now slowly end the massage with base of your heel, giving a nice massage to the base of your heel. And then you can give a nice pressure to your whole feet using your palm. Like you can hold your whole feet and give a nice pressure and finish off the massage. Give a nice pressure. Yes, I hope you enjoyed this massage. Now we'll do the same on the other leg. So before that, you can rub your feet with a towel so that it removes the excess oil from that. So never put your feet down with the oil on. It can cause like falls or slips on you. So never do that. Now we'll slowly start the next phase. Take a small drop of oil in your hands and spread it over your palms, and we'll slowly start with ankle joints. With the base of your palm, you can slowly start to massage your ankle joints. Now give a nice circular motion massages. Whenever you are massaging any of your joints, you need to give circular massage in a circular motion. Now slowly with your base of the palm, you can start massaging your whole feet. Give a nice stroke towards your whole feet. Now regular foot massage can prevent dryness, stiffness and numbness whenever you have these kind of symptoms. These kind of regular foot massages prevent them. Now slowly with your thumb, start to massage the tendons which is going towards each of your toes. Yes, give a nice pressure. The pressure should be even. It should not be very strong. So this gives a good, peripheral circulation towards the end of your feet. which gives proper nourishment to your feet. Now slowly continue the massage. So if ever you are affected with any burning sensation, you can take the help of a jade roller or a chilled spoon. So that gives a very cooling effect. Now slowly start to massage your toes with the thumbs. Each of the toe, from the base of the toe to the tip of the toes. You can give a nice massage to each of your toes. So this ensures proper circulation towards your feet. Now slowly let's start doing the base of the feet. Before that, you can give a nice massage to the Achilles tendon. That is the hard cord-like structure behind your feet. Yeah. So after that, we'll slowly move on to the base of your heel. For that, you can keep your feet over your next knee. And then we'll slowly start massaging the base of your heel. Now, many women suffer from cracks over the base of the heel, right? So regular oil massage over this area actually cures cracks on your feet. And it ensures proper cleanliness. Now, using the base of your palm, you can give nice strokes towards the base of the feet. So that your oil is evenly spread at the base of the feet. Now, you can make a fist of your palm. And then with this hard, bony texture like structure, you can massage slowly your heel, which gives a nice pressure, which improves blood circulation. And then you can knead your whole sole. You can just take this kneading massage to the end of your toes. Okay, now we'll start slowly massaging the toes, base of your toes. With the thumbs, you can start from the base of your toe to the tip of the toe. Give a mild pressure at the tip of your toes. So each and every toe, you can give a mild pressure. Yeah, so once it's done, you can bend your toes and then you can find a groove. Yes, start massaging the groove with the base of your thumb. So this is very relaxing. It calms your mind like anything. Slowly give a nice massage to this groove. And slowly come to the base of the heel and give a nice massage to your base of the heel. And with the whole hand, give a nice pressure to your complete feet. And then finish off the massage. So you can practice this every day. You can make this a regular practice. So this actually reduces many conditions, many health conditions. It improves your sleep. It improves your vision. Now slowly rub your feet with a towel and remove the excess oil, whatever is pending on it. Yes. So I hope everyone enjoyed the foot massage. So you can try this out on every day as a daily routine. Thank you so much.
Thank you so much. Thank you so much, Dr. Shehnaz and Dr. Khushbu. This in true sense, I can say, has been an absolute me time for all the ladies over here for International Women's Day. So thank you so much. And ladies, so far it has been yoga, it has been Ayurveda, you have been working out your muscles, your face. Now let's do something for brain. And this is all for fun purpose. Okay, let's do something for brain. We have some brain games over here, which I would definitely love to share with you. And you guys can answer in the chat box. Let's do for some fun purpose, just to make it a more celebration for Women's Day. Okay. So the first question is that, first of all, you really have to look at these or at these words very carefully and remember them, the colors especially. Okay. Having seen this, I hope you guys have seen this. Now, having seen this, Please tell me which color was purple. And I would love to see it in the chat. Your answers coming in the chat. Which color was purple?
Could you shut it, please?
Gray. Yes. Yes, Jyoti. Harbinder. Yes, Harbinder. It was gray. Absolutely. And then moving on from here. How many circles do you see over here? Your time has already started. Please tell me in the chat box, how many circles do you see over here? Anyone else? So okay, the answer was 7. 1, 2, 3. Then there is this O. And then when we started it, these were 3 zeros, which makes it 7. So this was just a fun trick question, just for fun. Okay, now the next one is, can you remember the shapes of all these images over here? Okay, just look at it very carefully and remember them. I'll give you 1 or 2 more seconds just to grasp it. Okay, now tell me which shape was on the top right corner. Can we have the answers? Square, anyone else? Square, square, circle. So this one, ladies, I've actually seen this pretty carefully here. Yes, it was a square. Perfect. Okay, so this was just for some fun thing. You know, the entire session has been so enlightening and relaxing that we thought to do something fun. Now, coming back to Nirva, I really feel, and especially each one of us at Nirva feels, that every woman should prioritize holistic health. You know, that should be the #1 priority. But we also understand that with kids, with family, you know, with busy schedules, sometimes financial constraints, everything goes for a toss and we are not able to pay attention to it. And for that reason only, you know, Nirva really wants to make sure that every woman is able to experience that goodness of Ayurveda and yoga, right? But before that, the question comes that why you should be even listening to Nirva. Like, what does Nirva do so special or so unique that all of you are here at this point of time attending this whole 90-minute session? What do we do so different? So we have a community of 3,000 plus women across the UK and US who have entrusted us with their healing journey. Now, I'm sure that all of you would relate that, you know, each one of us are different. Our body symptoms are different, the root causes are different, and even Ayurveda recognizes each one of us as different. So, of course, we cannot have one generic solution that can be applied to everyone. Now, this is exactly where Nirva Health steps in, because we give you personalized wellness solutions depending upon your condition, irrespective of your ethnicity and your location, but it's absolutely totally depending on your particular health concerns and your body type and everything. And we have a very strong network of holistic experts. We have naturopathy experts, we have yoga practitioners, we have Ayurveda practitioners, and all these experts here in the team, you know, they have had 5+ and 10+ years of clinical experience and 10,000+ hours of training. So this is why Nirva becomes so special. And with that, like I mentioned earlier, that, you know, women do not prioritize their holistic health the way they should be. And this is where we wanted to contribute and walk that extra mile, because we want every woman over here to experience that holistic health. So we are launching 3 new plans over here: Nirva Beginner, Nirva Enthusiast, and Nirva Explorer. Now, I want to give a backstory about why we are launching it. So we happened to meet a lady in one of our workshops, and who was very interested in joining one of our plans, but she couldn't because of some financial constraint, and she really broke down. You know, she had a breakdown over the call, and that particular moment kind of became the defining moment for us, and we thought that we really need to do something more. And that is the reason we came up with these 3 different plans. Now, let me tell you, you know, how these plans are different. So the first one is the free one. Just a minute. the Nirva beginner one, which is the free one. Here you get the free access to our exclusive FB women group, where something interesting is happening every day. And you also get certain limited features on the app, like your health lessons and your meditation videos. All of these are for free. Then comes our Nirva Enthusiast, wherein you are able to access all our premium community sessions, our Wake Fit yoga sessions, our yoga and Ayurveda workshops on different health topics that are happening within that month that you can access from the app. Still a great deal. And the last one we have is our Nirva Explorer. Nirva Explorer is miles ahead of that, because in here you get a dedicated health coach, you get lively your yoga sessions, virtual yoga sessions, you get your unlimited consultation with your dedicated senior Ayurveda and yoga experts who curate bi-weekly personalized diet and wellness solutions for you depending on your condition. And I mean, n number of your health concerns, which can be gut health, which can be joint health, which can be menopause. Along with, you also get access to those lovely recipes and your yoga videos and all the content that is there on the app. So that is what Nirva Explorer is all about. Okay, now here for this particular call, all the ladies that are out here, you get a chance right now to book your free health assessment. Okay, and this, I would say, this is like a limited time thing because the slots are filling in really fast. So I would suggest that let's book it right now. What I'm going to do is that I'm going to share the link over here. So you guys can go ahead and book and schedule your free assessment call with a health expert to understand how yoga and Ayurveda together can help you in your health journey. Okay, so I'm just putting it here, and what I'll do is that I'll also share my screen so you guys can have an idea. I can give you a walkthrough how to book your call. Here it is. Yes, and I would suggest that I would request everyone to do this because, like I said, this is for all the ladies that are here on the call. And second, that the slots are filling in really fast. Okay, so now I'm going to share my screen where you guys can check how to schedule your call. Now, when you click on that link that I just shared in the chat, this is the window that should be opening up. Wherein just make sure that the time zone that you have, that should be your local time zone. Okay. Then all the dates that are marked blue, these are the dates that are available for your consultation. So for example, if you say that you are comfortable taking it on 11th March, just click on 11th. After clicking, you will get all the possible timings that are there for you to take that consultation. So let's say you feel that it's convenient for you to take at 5 p.m. You click on 5 p.m. and then you click on confirm. After you do this, you get one more screen where you have to enter your basic details like your name, your email, anything that you want us to know so that we can prepare better. And if you want any SMS reminders. And after filling this in, you can just simply schedule your event and your consultation is booked. This is how easy it is. And like I said, that, I think this health is always right. Health is something that is always happening, and for to make that holistic health keep on developing, I think this call would be really, really significant for you. So if there's any problem in scheduling that call, if you think that you're getting stuck anywhere, please put it in the chat box and I would love to help you out. And yes, Veronica, that's lovely. You're already a Nirva Explorer. Already a member of Nirva. Great. Already on plan. Perfect. Anyone else who's not on plan but would like to schedule the call and having any problems, please let me know. I'm signed up. I'm already on plan. Or if you have booked the call, then also please let me know. Give me a thumbs up either in the chat box or through reaction so that I may know that you guys have booked it, please. Who all have booked it, if you guys can just put it in the chat box. Okay, Dee, I can do this for you if you can just like stick around. I will do this. And you. Nehal, you don't have the link. Let me just share the link again. Wait. I'm putting in the link again. Here it is. You can access the assessment call link from here. And D, what we are going to do is that we'll do this. If you just like stick around to the end of this presentation. So moving on, if you guys have already booked, some have booked, some are already there on the plan. So let's do one thing. This is the last part. Okay. And yoga generally is pretty relaxing, right? It can really unwind you after a good tiring day. So, but yoga can also become a lot fun if we are doing it with other people, right? So for that, what we are trying to do is that we are trying to bring up a challenge over here, for which you'll have to download our app as well. So in this, what you have to, this is a 7-day yoga breathing challenge, wherein, the typical yogic breathing, we are trying to get you to the deeper levels of yogic breathing in this 7-day challenge. For that, what you have to do is that you'll have to download our app, and all the other challenge related questions, all the notifications, you will get there in the app. So just link it with the chat and then stay tuned, because once the challenge is launched there, you'll get the notification. Okay, so what I'm going to do is that I'm going to share the link of those of the app download for the iOS and the Android, and you guys can download the app from there. Just a minute. So I have put it here, and you can download this app. After downloading, just make sure that you've linked it with the chat. And as soon as our challenge gets launched, you'll get notified. And then from there, you can participate in it. Here, you will definitely get to the deeper levels of yogic breathing. And also, you won't be just competing with your own self, but you'll have a community of your other women friends as well. Okay, now with that, I'm opening the house to questions and feedback, just in case if you guys have any queries, you have any questions to ask Dr. Shehnaz, Dr. Krishna, Dr. Khushbu, please let us know. The house is open for questions. We can take it. You guys can ask in the chat box if you're feeling uncomfortable, or you can unmute yourself.
Hi, doctor. Thank you. I'll ask a quick question. Where I come from in Sri Lanka, we are advised not to bathe during the first 3 days of the period. Is there any Ayurvedic basis to this? What would be your advice? Thank you.
Thank you, Sharmin, for the question. Yeah. Actually, in the traditional view, it is told not to take bath during your periods, but the modern science are, having the evidence that taking a bath on your periods can actually prevent you from infections and keep you clean. So, yeah, basically in Ayurveda, it is told, but, as time goes with researches and more evidences, like we have been told that taking a bath is actually good. But whenever you clean the vaginal area, make sure that you're not cleaning from back to front. Okay, that can harbor infection.
Thank you. Thank you very much for that.
Thank you, Sharmin.
Hi, doctor. This is Jyoti. Just wanted to ask how to activate this challenge. I have an app already.
Okay, Jyoti, you will get the notification in your chat whenever the challenge is launched on the app. This is the reason I said that once you've downloaded the app, link it with the chat As soon as it goes live, you will be notified, and then all the details you'll get there.
How to link it with the chat? It's already been downloaded.
It's already been downloaded. Do you have that option there?
I'm not sure. Where do I go?
Okay, so what I can do is that I
Chats
can,
is there. There is a
yes,
chat option.
yes. So just stay
And
tuned,
then
as in just keep checking. Else, just like check it once in 2 days or something. You will get a notification within few days whenever the challenge is launched, and you will get to know about it.
okay.
Okay, you
Okay,
don't
I
have
was
to
the
do
one
anything.
who
You just have to check the chat. That's it. You get to know.
okay. Okay, yeah, and I was the one who messaged about the meniscus tear. I had surgery last week, and I have already enrolled your program. I spoke with one of the doctor yesterday, and just wanted to check: can I attend your yoga sessions at 7 o'clock in the morning? Like how whatever I can do.
Yes, Jyoti, actually, with a meniscus tear and post surgery, it is okay to do yoga. We have a lot of practices which can be done, all right, which can be modified according to what is required for you after the consultation. Have you completed the consultation part?
No, regarding
Okay,
yoga, I didn't. It's just a basic consultation yesterday I had.
okay, all right. So you will have a book consultation book, and after taking a detailed history about the surgery and everything, we'll be recommending certain things which are suitable for you, right? And it is
So okay.
possible to do it in the morning. Yes, it is possible.
Oh, okay. So till the consultation, sir, I was asking you. I was asking you. I just broke. I was asking like until the consultation, I wouldn't be able to attend the yoga sessions, right?
We usually book yoga sessions only after consultation because we take a detailed
Okay.
history and then we do the yoga sessions. So it happens
Okay.
that way.
Okay.
Yeah.
Okay. Yeah, thank you.
But meanwhile, you can do the breathing part. We just show the breathing today, the deep breathing, or that you can do, not the physical part. No, I wouldn't recommend that right now.
Okay. Okay. Fine. Thank you.
Thank you so much, Pooja. Jyoti, sorry. Anyone else who has any query, or in case if you guys want to give us some feedback to us, you want to tell us how did you find it, though we are getting messages on chat, so that's pretty endearing. Thank you so much. I think Mate has one question. What are the principles of sattvic diet? Trishna, you're not audible.
Is it better now?
Yes, much better.
Okay, all right. Thank you. All right. So sattvic diet is a diet which is usually vegetarian and which is easily digestible for the body. So it's based on the principle of three gunas. We in yoga we say there are three qualities that a person has, and we want to have the best quality, that is sattva. And sattvic diet is one which enhances the sattva. So it makes a person very calm, very peaceful, mild, not aggressive, not lethargic, but energetic to enjoy life in a positive frame of mind. Okay. So usually what consists of sattvic food is milk, and no spices, not very strong spices, very simple rice and stuff like that. Not very, heavy foods that are very difficult to digest. Nutritious food, easy to digest. Yeah.
I hope, Mate, you got the answer that you're looking for. Alka, do you want to ask something?
Yeah, sorry, I had to come on my phone. My tablet wasn't working, so I had to switch on to another. Yeah, I've got a very dry skin all over my body, and I put coconut oil, but it's not going. It's itchy. I'm struggling, and it's cold here in London, so I don't know what to do. It's like sort of hands are really bad. My hands are really bad. It's all cracking. So I didn't know. I do have gut issue, which obviously I've got that plan. So I don't know if it's related to the gut diet. I don't know. But it's really dry, really, really dry.
Hi, Elka.
Hi.
Yeah, so yeah, for dry skin, there are many factors. When you have a cold weather, you have, more of dry skin, many external factors, also diet and, your body type, all these, comes together. So it's better to take a direct consultation and look out for what the root cause is, and then have a proper diet. And also you can have external application of the right oil, chosen after this proper consultation, and then take it over. Okay.
So, okay, then I'll talk to my health coach. That's fine. Okay.
Yeah,
Thank you.
exactly.
Thank you.
Okay.
Thank you.
Thank you.
We have one more question from BP, that what oils are good for foot massage?
Yeah, for foot massage, we can use sesame oil. Sesame oil is always recommended for everyone. So maybe some people won't like the smell of it. So for that, you can, replace with coconut oil or mustard oil. Yeah, all these things can. And if you have any specific health condition, you can have medicated oil. Almond oil is also fine. Yeah, for the medicated oil, you need to take a consultation and find out which suits you the best.
Okay, great. Any other queries, guys? Any other question? Or if you guys have not booked, if not a member, or if not on a consultation call, if you want to book a consultation call, if you're struggling, got any query, please let us know. Divya has a question. I have acne on my cheeks. Which oil is suitable?
Hi Divya. So basically, when you have acne on your face, oil is not actually recommended. Oil can aggravate, make your oiliness of the skin increase and cause you more acne. So mostly honey can be used when you have acne, more of acne. But if you're having a dry skin, then maybe yogurt can also be used.
And there's one more from Deepthi. What can help with PMS related migraine?
Yeah, for PMS related migraine, you can have deep breathing techniques, which are very useful. And also you can have certain pain relieving medications, like herbs are there. But as I told, we need to find out what suits you the best and then recommend you, rather than, giving you general recommendations. Deep breathing techniques can always help.
Divya is asking, I think that's in continuation to what she asked, that she has acne on cheeks, so which oil is suitable? She's asking honey with gram flour.
Yeah, gram flour can be used, but if you have a very dry skin, not gram flour, instead of that, you can use oats powder.
Great. Any more questions, ladies? Anything you would like to ask? Face yoga, foot massage, yoga, Ayurveda. Amara is saying Multani Mitti is good.
Yes, Multani Mitti is good.
But with Multani Mitti, London is very cold. Like in the Western world, it's very cold, right? And Multani Mitti can be so cold for your body, isn't it?
Yeah, and I think it can get too sticky as well.
Yeah.
Jyoti has an interesting question.
Yeah, it's called a Zoom setting, which is the secret. Face yoga improves my blood circulation in face. So there are some visible results as well, as I can read. Face yoga improves my blood circulation in face. That's what Divya said. How often do you do the face yoga? Amy has asked this, Amy Layton.
Yeah, you can do it every day, Amy. Actually, it is something to kind of, you're looking at kind of shaping up your face and, massaging the muscles, kind of tightening the muscles, strengthening them in a way. So for that, it's better to do it every day. And get the circulation and the lymphatic circulation and everything. Yeah.
Anything else, ladies? Anything you'd like to tell us how great the session was? How knowledgeable was it? How great you felt?
It was a great session, Doctor. Thank you very much.
Thank you
I
so
think
much,
it was the best so far that I have participated for the last 3 months. I've not participated in every session. I've missed a few, but today was really great. Yeah, thank you very much to all involved.
Thank you so much, Sharman. That really means a lot. Thank you. We appreciate it. It was true to its name. It was actually Women's Special for Women's Day. Thank you so much. Thank you all. And with that, if we do not have any questions, thank you, each one of you for showing up and being here and taking out time. And we're really, really glad that you thoroughly enjoyed each and every part of it. So thank you so much to all the amazing people. I would really quickly like to thank Dr. Shehnaz, Dr. Krishna, and Dr. Khushbu for being here and guiding our audience through this entire session. And as I said, that we can see some visible results. So thank you so much. And on that, if there are no more questions, okay, one question, I think. Seasonal foods we need to pick. It's a question, or I think it's a question. She wants to ask which seasonal foods we need to pick, I think. Right, Vidya? Yeah. Which seasonal foods we need to pick.
Was it a question?
Which seasonal foods we need to pick.
Like for each season, there are many recommendations. Like for winter, you need to have, very light, but what takes time for digestion so that it keeps you full. So that is there. In summer, you need to take cooling foods like more of coconut juices, all those things which gives you nourishment during the period. So likewise, we have many recommendations. It would be a lot to talk.
Yeah, that would be in the plan or on the consultation call. Thank you everyone. Wishing each one of you a very happy Women's Day once again. And with that, we would wrap. Thank you. Have a great day and
Thank you.
great week ahead. Thank you so
much.
much. Take care. Bye.
Thank you. Bye.
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 Have a good night. Thank
Good
you.
night.